Welcome, dear participants. This is our first webinar series on the theme Shaping the Next Normal. It is said that every time there's a disruption, there is also a transformation. And this transformation, the way it happens also depends around the environment it is in. So through this webinar series that we plan to have during the the next 4 to 5 months, we will actually look into this environment through which through different perspectives actually, and try and understand a little bit more about where we are headed. Are we going to go back to our old selves, or are we going to go back to a different normal? That is the whole idea of this series. Now, in today's webinar, the first topic which we thought we will look into is the socio-cultural environment. I understand the socio-cultural environment is a very, very broad topic. And so what we will try and do in today's session is, take out a few, slices of, this environment. We will focus on the individual, we will look into families, and we'll also look into the community and try and see, through analysis of data, by applying science, try and see if we can actually get some get some changes in behavioral patterns, because understanding that could probably help us figure out how our ways of working, how our ways of life will change in the years to come. So before I invite the panelists or introduce them to you first, let me just give a brief introduction about Xime. For those who haven't heard of Xime, we are one of the top 50 business schools in the country. We have campuses in Bangalore, Chennai, and Kochi. This institute was founded by Professor J. Philip. He was the former director of IIM Bangalore and also the former dean at XLRI. Our heritage goes back 26 years, but our campus in Kochi is just 8 years old. We're very proud of our diversity. 85% of our students come from almost 21 states in the country. And we also got a near 100% placement record. Now, that's a little bit about the institute. About myself, my name is George Paul. I teach here. I'm also the Dean for External Programs. And coming to our panelists, we have two experts from one of the premier Institute of Social Sciences, which is the Rajagiri College of Social Sciences. It's an institute, again, in the same neighborhood as ours, same town as ours, which is Kalamasheri. Our first panelist is Dr. Anish. He will be taking up the role of the social scientist in this panel. He is an assistant professor at Rajagiri. He has over 20 years of experience in social work, in teaching, and in research. He's also an honorary member of various industry bodies. Welcome, Dr. Anish. The next panelist that we have is Dr. Sanju George. He's an internationally renowned psychiatrist in the field of addictions. He works as a senior clinical psychiatrist and professor of psychology and psychiatry at Rajagiri College. He's a prolific academic and has published over 2,000 papers. Welcome, Dr. Sanju. Now, before we actually, go into the webinar will, have two parts to it. The first part is we have the panelists making a short presentation, sharing their insights. After that round, we will go into the Q&A. So we have a Q&A box. If you have any questions, please, shoot those questions. But before we, start, let me set the context, or let me, have, a couple of polls to, as an icebreaker. So I request you to please answer these questions. I have a set of 3 questions. Here's the first question. Yeah. 10 more seconds. Okay, so I will stop it here. So here is the first poll. It says that a majority of the people are a bit concerned, but they find it manageable. There is a small percentage that says that they are very worried. Yeah, nobody is thinks it is catastrophic, which is a good thing to note down. So let's go to the next poll. With the opening of businesses and restrictions being lifted, how do you foresee your family's income prospects in the coming year? The economy is expected to open up. We've had a very bad quarter. Last quarter was very bad. But again, we're not too sure how much the pandemic has affected or impacted people. So if you can give your insights, then it's good to know what the group is thinking. So I'll stop it here. It's I'll share the results. So 54% of the audience thinks that income is more or less protected. It's just a little lower than before. 23% feels that it will be the same as what it is now. And for a small majority of people, at least 23%, I think it's very tough times ahead. Okay. So go to the next icebreaker. I'll launch this poll. How do you rate this year's Onam celebrations compared to previous years? Very dull, a bit muted, same as last year, or grander than last year? If I, I live in Cochin, and when I look at the traffic, just before Onam, I thought, it was like a normal day from last year. Hectic, traffic snarls, a lot of shopping. Okay. I'll end the polling here. I'll share the results. It says same as last year, is a very small percentage, a bit muted, 25%, and very dull, 67%. Okay, so I now invite Dr. Anish to share his insights. Dr. Anish will present the big picture. Go ahead, Dr. Anish.
Thank you very much, Professor George, and all the faculty, including Dr. Meena from Xime. And this is a golden opportunity for me to speak to the august audience on the socio-cultural flux in the context of COVID-19. Let me start with presenting my screen. 1 minute, please. Okay, so I'll be speaking for the next 13 minutes on the socio-cultural flux of this particular pandemic. Now, we know that no other pandemic has ever scarred the globe like this. This is the picture of the map of the world. The one from the WHO and second is from the Johns Hopkins University Research Center. So you could see that the whole world is scarred because of this pandemic. Generally, it is not like that. It is on regional specific. This is a status of Kerala, where you could see there is an increase in number of cases all these days. So we are finding 2,000 plus every day. One of the good things is that most of the infections are mild and people with no other existing health conditions are least affected. That's good. But this has a health problem, which has a lot of social and economic crisis, which has resulted into problems in life. So now we know that what was the life when we started in January and what is the situation in September, you could see that there is a change. We were almost stable till March, and we were coming down to a position in June. Now we have increased cases and issues in Kerala with regard to the COVID-19 cases. So it has impacted both our personal and social lives. Now, COVID has no discrimination. You could see every one of us are affected. If you look at people around us, people of all cadre has been affected because of COVID-19, one way or the other. So people and persons are in lockdown, children, youth out of school, our colleges, or families of persons infected, they affect stigma, special populations like people who are disabled, then frontline health workers, and the persons of infected. So all are affected because of the COVID-19 pandemic. Now, when we look at the impact on the individual and family, I would like to share 4 stories with you. The first story is of a 19-year-old boy who had called out call center for support when the lockdown was continuing in the month of April. This is a 19-year-old boy who had little contact with his own family. His communication with the family was limited, but he was forced to be at home. And he had a lot of frequent fights with the family members. Anger was unmanaged, and he had a lot of issues with the family, and the parental interaction was strained. So he wanted support. So he called up our call center when we initiated a Rajagiri Wellbeing Initiative. The second case is a 62-year-old migrant laborer. She came from a guest worker. She came from Tamil Nadu. She used to work as homemaker, a housemaid in different houses. Her entry to houses was blocked. She had no income. Her place where she was living, she had to pay rent. She had to take care of her own family back at Tamil Nadu with her pay. So she was affected. Now, third person is a 55-year-old lady Montessori teacher. She was a successful Montessori teacher. She had a well-functioning Montessori school functioning in the city. I don't want to mention the city of the other person. So she was doing fairly well. Then people told, "You are doing so good. Why don't you start few more centers?" She started 6 centers over the last 3 years. And she had rented houses or rented places for the schools. Now all the schools have been closed for the last 5 months. She had to pay back the rent. She had paid 65 lakhs of rupees for us deposit to this owners of the houses. And she had to manage that. Now she had to stop all the schools. She had to return back all the houses. She paid rent for 3 months, and she had to forgo some amount of the money she has given us in the deposit. So the fourth is a family where a 78-year-old father, he always insists, he gets up in the morning, he wants to go to church. He wants to go to church. And he dresses up for the church, he wants to go out of the house. When family blocks him, he becomes very violent. And same way, in the evening, he comes back, he again dresses up for the evening walk, where he wants to go to the small city around near to the home and to have chit-chat with his friends. So whenever the family was trying to control him, he became so angry, so violent, he was unmanageable. So these are some of the cases which we found. So from these cases, I want to look at all these dimensions. That there was impact on home and family, work was impacted, commuting was impacted, recreation routine was impacted. So I don't want to talk too much because we're all being affected. So I've put up these points just to indicate that all life of human beings, whatever is concerned about our life is impacted. Employment and livelihood, our relationship with people, our commerce and lifestyle activities, customs and traditions, religious practices, education, recreations, health, everything is impacted because of this COVID-19 pandemic. Now, when we look at work and family resources, we found that job losses, non-payment of salaries, reduction in wages. I've heard from a lot of my friends who work in academia, work in other settings, have been lost job or reduce their wages, and they see 400 million Indians deeper into poverty. That's a study from the International Labour Organization. All sectors, IT, manufacturing, construction, catering, event management, transport, take any sector, every sector is influenced. So now this is a document based on the Google COVID-19 community mobility trends. So Google has a very beautiful document. If you can go to the site and identify this, this looks at 5 areas of human life, how people commute from one place to other. The first thing is that there is an increase in percentage of people spending at home. If you see the flex of time, February to August, you see that there was an increase in number of people spending time at home. Even in India now, even more than 15% of people stay at home. Now you look at second aspects, grocery and pharmacy, essential things, workplace, travel to workplace, transit places, or retail and recreation, parks, everything is affected. If you look at the recreation activities, it has been affected very drastically. Even around 50% of people are being affected because of this particular COVID-19. So our life is being affected because of, all realms of our lives have been affected because of COVID-19. Yes, the family time. Yes, some of the families had a back home time. They had a lot of fun time, enjoyment, fun, happiness time. Some other families had tough time because they had all type of issues which came up, because all the issues of family, when they came up and start together, start coming up again. Some families had such issues. Another group of families are working from home. So I think the working from home, the women are most affected people because they have to take care of multitude of tasks in the family. So everyone is affected. So family time is good, at times bad, but the cases we have seen. Another thing is that the Women's Commission of India has clearly brought out an idea about how many cases of domestic violence have been reported. We found there is an increase in issues of domestic violence. So in 2020, you find there is a steep increase in the number of domestic violence cases. So, and there is a lot of underreporting. Only 14% of people have reported these cases. They still suffer at home with those domestic violence. And when I look at from a lifespan perspective, looking from a children to youth to adults to older adults, you could see everyone is affected because of COVID-19 impact. So there are positive impacts, but there are a lot of negative impacts on every people. If you look at children, they are affected. They are out of school. They're online teaching. Their mental health is affected. Physical activity is affected. Youth again. So all the population. Now looking at the cultural and religious practices. Now there is no distinction between any religion. So all festivals, Thrissur Puram has been closed. All festivals of church-led festivals have been closed. No mosque-led activity. So all religions have been affected. People were asked to keep away from families, from churches or religious places, practice places. Initially, it was difficult, but we all learned to do that. We all learned to keep away from the religious practices and cultural practices, and we learned to how to conduct a marriage with 20 people or 50 people. We learned how to conduct a celebration with less number of people. We even learned how to manage funerals with less number of people. So life was changed because of these things. So we don't know how it is going. Now looking at our commerce and lifestyle, going a bit fast. Basically, when we look at the commerce and lifestyle, there was a movement from the multi-storied buildings of supermarkets to places of online shopping. Or I found another positive impact is that a shop near to my home, which was not having much people, much sales, now the person has renovated the shop into a bigger shop now because there's a lot of sales in that particular local shop. I think there's something which probably business can study how impacted that on the people of local shops compared to that of malls and such places. Our hygiene habits have changed. Our children are playing at home. They are restricted to leave home and play. Now, the thing is that they enjoy doing that. Now, education is a sector where we know that it is impacted because of the online education. Now, we were keeping our children away from mobile phones or media. Now, screen addiction is becoming a problem. Probably Dr. Sanju will talk about it. He's an expert in that area. So basically, another group of people is migrants. We have seen a lot of migrants going back. I just want to talk about these four words I've written here. Very important. The estimates. Now, government do not have an estimate. How many people are there? How many people are going back? How many are coming back? No estimate. So no solid estimate is available. Now the UN is discussing about it. ILO is discussing about it because there's no estimate. The Global Compact on Migration now talks about lack of estimate. Their first agenda itself is creating data on migration. That's a big issue. Now Vande Bharat flights have started. We don't know how many. So we found 8 lakhs people registered for Vande Bharat. Now how many people are coming back? Now return migration is a big issue. What will we do with these people? People are coming back to our state or people. Now re-migration. Many of them feel that now the GCC countries are better. Why I came back to Kerala? Why can't I go back? I need to go back now. Now there is no job. They have restrictions to travel back again. So re-migration is an issue. Another major terminology which I heard from Dr. Hridaya Rajan, is an expert in migration, is called distress return. Distress return is those people who migrate to other countries who had come back because of COVID-19. who have not been able to raise the fund they spent for their going to Gulf or the GCC countries or the European countries. They spend a lot of money, think that they'll earn a lot of money, but they have to come back because this, now they don't know what to do with that. So they have debt because of these things. So migration is a big issue which is affecting the socio-cultural context. Now we are looking at our construction labor. We are looking at our own social context. Where how do we manage all this work if the migrants do not come back? So now transportation again. Now I heard from Dr. George itself that there is an increased number of cars, second-hand cars sold in this last few months in Kerala, because no one wants to travel by public transport. People want to travel by themselves. So they don't want to depend on bus, they don't want to depend on train, they don't want to depend on taxis. They want to depend on their own cars. So they started buying, people started buying second-hand cars. There's an increasing number of people are buying that. So transportation is impacted. Now, how do we balance this? This is very important. So this socio-cultural interest, though there are issues, but we have to come back. So how do we balance COVID and our life? So we have to shield ourselves from the COVID-19 and its impact. So we have to balance it. So the Human Development Initiative of the UNDP said, we need to talk about enhancing the capabilities of people, from basic capabilities to enhanced capabilities, especially by giving quality healthcare at low levels, high quality education, effective accessibility to services, resilience to be developed. So with that, next two slides I will wind up. So resilience at the time of COVID-19 is very important. There is an adverse situation, we have to come back. So coming back is very important. We will come back. That is very true, because we have seen 2 floods in the previous years, some sample of the flood this year also, but we have come back. So we will definitely think that we will come back. So we need to advance despite adversity. So that is the context of this presentation. So with that small, so there are a lot of initiatives from the Kerala government. You know, there are a lot of helplines, a lot of voluntary initiatives, a lot of government initiatives which are very helpful, which is a model for the whole world, how to handle a pandemic like this. And we know that depending on the first case was found in Kerala first, but we have not grown the number of cases in that context. So we have done well. This is a video from the Indigo that they say about hope. So I just want to end with this hope video, a small video for 1 minute. They all say we will fly again. We will fly again from this COVID-19. Thank you. Over to Dr. George.
Thank you, Dr. Anish. I think you've given a context. I think we will have questions to understand it from a behavioral perspective, and also from a Kerala standpoint, because all this new habits that we have developed, where does it translate to? So we'll come to that. In the meantime, I will request Dr. Sanju to share, as we discussed, to borrow your own words, everything is in the human mind, right? If you look at culture, if you look at social behavior, if you look at economic growth, everything comes from the everything is governed by the human mind. So I will request you to share your perspective on what you've seen in the last 6 months, and where do you think it's going. Go ahead. Yeah, thank you.
Thank you. Let me just check. Professor George, can you hear me? Am I audible?
Yes, sir, you're audible very much.
Yes, you're audible, sir.
Yeah. Okay, yeah. So let's kick off. Dr. Anish ended by saying we'll fly again. So let's take off on a slightly different tangent. So to begin with, good evening, everyone. I'll keep you engaged for the next 12 or 13 minutes. I've been told by Professor George, and any more than 13 minutes, he'll take me off screen. So thank you, Professor George, Dr. Meena, and rest of the Xime team for creating this opportunity for us to pull our brains together and brainstorm. Please don't see this as a one-sided lecture, in which case it will be terribly boring for you and for me. The task I've been given is to talk about Kerala's socio-cultural flux. I've slightly, with Professor George's permission, I've slightly tweaked the topic so I can be of some help, because that's my area of expertise. So I'll stick to Dr. Anish has very nicely painted a very comprehensive picture about how the pandemic has changed the shape of our lives, and it's affected all aspects of all our lives. Now I'll stick to what I know best, and that is trying to talk about the psychological impact that COVID-19 has had on us Keralites. That's not to say that psychology, sociology, and anthropology, that's the psycho, social, and cultural bit, they're all obviously interlinked and intertwined. So please don't see this, the bit of my talk, as in isolation, but see that within the broad canvas presented by Dr. Anish. Now, again, what I'll stick to is what we know from the studies that we have carried out, and also some of the real life examples of the patients who I see in my clinic. So I'm not here to tell you about what I think, because we can all think what we want, but what does evidence tell us, and how does it inform us in terms of what we can learn from what's happened and what we can plan for the future. Now, Dr. Anisha's team, Department of Social Work.
Dr. Sanju, can you please put your screen on full screen mode?
Or is it not?
No.
Yeah?
Yeah, they're done.
Yeah. So Dr. Anisha's Department of Social Work within Rajagiri College of Social Sciences, and my department, the Department of Psychology, jointly in the month of April, we carried out a piece of research looking at how the pandemic and the resultant lockdown impacted on the mental health of Kerala's adult population. So we looked at slightly over 1,000 adults. So the key points to remember are: one, the sample size of 1,000, and two, it was conducted in April when we were going through a severe lockdown phase 1. We looked at several things, but for the purposes of brevity, I'll just stick to a few things that might be of interest to you. One is we looked at how stressed these individuals were. We looked at their levels of depression, their levels of anxiety, and some who could have had post-traumatic stress disorder, and several other things. So just to highlight a couple of things, the large majority, if you look at the numbers, the percentages who experienced mild and moderate depression, so close to 90% of the sample studied had a syndromal depression. Yes? The sources of stress, as we could all guess, it was generally worries about what was happening around us, worries about the future in terms of what might happen, and more day-to-day and realistic worries about what might be the future of our job, future of our business or businesses, and so on. So in summary, in terms of what we found, one was we all need to acknowledge the negative impact such a huge pandemic can have and has had on the mental health or the psychological well-being of individuals. And I think a big lesson for people to learn from this is that both healthcare providers, the ones who offer healthcare, whether it's hospitals, nursing homes, and other healthcare workers and professionals, and it's also important for those who make policies, the policy makers who are involved in determining what public health strategies should be and public health intervention should be, could very well benefit from some of these observations or findings of our research, saying that the large majority of people are hugely affected, resulting in depression, anxiety, severe stress, and a host of other mental health conditions. Now, just one point about the future. So what can we learn and what should we learn? In terms of future pandemics and in terms of future large-scale catastrophes, we all need to have, we at an individual level and the society at a collective level, we need to have appropriate policies and measures and support strategies in place to make sure that those who are affected by these events in their terms of detrimental mental health get the adequate help and support in a timely and professional manner. Dr. Anish listed a host of various measures that the government of Kerala has put in place. That's great. But we all need to ask ourselves, is this the best that we could do? Is it timely? Is it appropriate? Is it professional, delivered by qualified professional people? And is it reaching everyone who is in need? Yeah. So just one word about the future. You know, I'm not very sure about the source, but I terribly like this one. In terms of mental health, whether it's psychiatry or psychology, it's very difficult to make predictions. I'm sure, you know, I agree that pseudo-intellectuals would love to do that. So I deliberately stop myself from making any predictions about the future in terms of people's mental health. If you ask me, would things change? At an individual level, some of us might change. At a collective level, I remain skeptical. Now, so much about what our research has told us, has informed us. Now, how does that translate? I'm a clinician, I'm a clinical psychiatrist. So I see people in my clinic. So having done this piece of research with Dr. Anish and the rest of our team, I'll quickly share with you over the next 6 or 7 minutes. I'll share a few case vignettes or examples. A few details have been anonymized, but these are all real people who I've seen in the past 3 to 4 months. So what I want you to do is, while I present these case vignettes, for you to reflect on how some of the pandemic-induced socio-cultural and psychological changes have resulted in these people presenting to a psychiatrist. Again, bear in mind an important point that Dr. Anish made when he talked about domestic violence. Less than 7% of people who are subjected to domestic violence seek help to professionals. The same is the case in psychology and psychiatry. Of the 100%, or if 100 people who experience mental health difficulties, less than 5% seek help. So the ones I'm talking about are those 5%. So there's a huge number of people who need help, but who are not seeking help or who are not getting help for various reasons. That's for us, or those of you who are involved in policy making, to think about. So the first one, adolescent boy brought, or dragged into my clinic would be a better word, for treatment by his parents, saying he's addicted to his mobile phone, he's spending a lot of time playing games. Now, why could this have happened? Online classes, easy access to the laptop and mobile phone, unlimited, unrestricted access, less or very limited parental supervision. He was also, unfortunately, the victim of cyberbullying. So he resorted to gaming or spending excessive time playing games as a coping mechanism, given what he was being subjected to. Yeah. So think about the role of the pandemic, role of the lockdown. What could us, most of us who are parents, what could we have done? What could educational institutions have done? What can a psychiatrist do or a psychologist do? Case number 2, a couple in their mid-30s came to me for family therapy or marital therapy. They both noticed that they were not getting on as well as they were. Extremely high levels of stress affecting their work, other aspects of their life, and most importantly, the quality of their marital relationship. Both were forced to work from home. His in-laws were at home, which didn't help, which again, in my clinical experience is a very unnatural situation for in-laws to be at home, sometimes worse than the pandemic itself. Number 3, an elderly lady, 63-year-old woman, sought help because she was feeling lonely, sad, and was having panic attacks or anxiety attacks. On assessment, I felt she probably had a low level of depression even prior to the pandemic. So there's one point I want to drive home, that is, this pandemic could have exacerbated pre-existing psychological problems, exacerbated in terms of the magnitude of the severity. And probable reasons, very obvious: severe restriction on her fairly active, despite her age, she led a fairly active social life that had to be curtailed because of the restrictions related to lockdown. Last but one case, a doctor who was brought, a practicing surgeon who was brought to his wife. He had started drinking more than usual because of the huge financial impact. He runs a hospital, started being more irritable with his children and with the wife. Wife had to stop work because there were 3 kids who needed constant supervision with online education. The last case was of a gambler who used to spend most of his daily wages on buying lottery tickets. And some of you might know that Kerala state government exclusively runs all state lotteries in Kerala. And this was also banned, just like alcohol, for 2 months, from March to April, March to May. For those 2 months, the government completely banned the sale of lotteries. So this man switched to online gambling, both from India and abroad, which is very much possible, I came to realize. And sadly, because of huge debts he gathered over a 2-month period, which ran into lakhs, which for him was a huge amount of money, committed suicide, and the wife and one child came to me for support. So please do see these 5 real life people as a tiny proportion of people who came to seek help. So think of a large number of people who are not still accessing help. Now, the last 2 slides that I have, the real reason why I came here to talk to you, other than finding it difficult to say no to Dr. George Paul, the real reason is my agenda is just one thing. Every chance or opportunity I get or I make for myself, I aim to destigmatize psychology and psychiatry. Just like we see physical health conditions, if I have the slightest headache, I run to the neurologist. I have the slightest joint pain, or most of us, we run to the orthopedician, the joint specialist, all the rest of it without any hesitation. So if you think you're not well in your mind, if you are not as well as you were previously, if your partner thinks, if your friends think, if your family thinks, or if you think, please do seek help. Mind is an organ just like all other physical organs that we have. So if that message has got across to you, I think I would have succeeded in what I came here to do. If you can forget everything else that I talked about, but please do bear that in mind. Going back to the earlier point I made about, do I really think we as a society or culture or as a collective unit will change? I'm not so sure. If we change, good, but we can change. We can be more aware, whatever COVID has taught us in terms of what life is really worth and what aspects we thought were very important before, our priorities might have changed. So if we have managed to change all that, bear in mind, life is indeed very short. So reprioritize things, and our own psychological well-being should be somewhere at the top of that list of priorities, and let change start from within us. I'm a great believer in that, the least we can do is we change ourselves. And then if we have time and can put in the effort, let's try and change Kerala and change the world. So I end on that note. Thank you.
Thank you, Dr. Sanju. Very enlightening presentation. So maybe, I will request the participants to, put in your questions in the Q&A. And I already have a few questions. And the first question is to Dr. Sanju. You talked about, bringing in a culture or an appreciation of, the importance of mental health. So, in Western, countries or in more developed countries, going to a psychiatrist is not a taboo. So in India, or I'm not too sure how it is in Kerala, but it is considered a taboo. Yeah. Now with this, pandemic, with this, totally, different, set of external factors, where do you see this, appreciation of, going to a psychiatrist, working out? I mean, what's your take on that?
No, I think stigma in seeking psychological help is very much more in Kerala and in India. And an interesting cross-cultural comparison is when I worked as a psychiatrist in the UK for 15 years, you are right in saying for the slightest of issues, people used to come to us. Whereas here often there is a saying, the first thing a colleague told me when I came back to practice in India 6 years ago was start your clinic after 7 p.m. in the evening. The reason being, not many people will see you going to a psychiatrist. Under the cover of darkness, you go to a psychiatrist. Otherwise, what will people say? So that is the first point. Stigma is definitely there. That is not being disputed. But I think more important is what can be done. Of course, there's lots of things that can be done. But I think at the very least, awareness raising and public education in terms of what is mental health, what does it entail in terms of seeking help from a psychiatrist or a psychologist, what avenues are there to get help, and kind of integrating that into general physical health and not kind of alienating psychiatrists and psychologists and seeing them as different from qualified professionals. And that such kind of awareness raising or education, the earlier it starts in one's life. So let's start off with schools and colleges and then look at other public health education strategies. So there's a host of measures that can be put in place for all that to be done in a coherent manner and in an effective manner. Then it needs to be acknowledged by policymakers. And when I say policymakers, that needs to be a joint multidisciplinary effort by both the government, other relevant NGOs, other academics, clinicians, politicians, and so on. So to bring them all under one umbrella and to drive this forward in a sustainable manner will be a huge challenge, but it can be achieved. And I'm sure things are changing a bit, but you're absolutely right in saying that that change hasn't gathered momentum. And simple things like, celebrities coming out in the open, Deepika Padukone coming and saying and acknowledging that she went through an episode of depression is a great step in the right direction. But again, there's a fine balance. If you look at how things are being played out in the media of, a superstar suicide, again, it has, upsides and downsides. So it's important to send the right messages, targeting the right people.
Okay, so
stop by saying that.
Yeah. Okay. So the next question I have is for Dr. Anish. You mentioned about the the Kerala floods, which was like a once in 100-year phenomenon, and some of us still have those scars. But have you really learned anything from that? So again from this pandemic, there's a lot of behavioral changes. We've adopted new things. And so where do you, so what's your view as a social scientist on this? Is there anything that gets triggered in terms of our future behaviors?
I think that's an excellent question. What we have learned from previous experiences. Now, if you look at these type of incidents and disasters or such crisis situations, that has helped us to be more resilient in future. For example, the impact of 2018 floods have been so bad, where we could see how volunteerism, how social connectedness, how youth involvement, all were being beneficial in terms of managing the crisis. Now, when it came to the second part, that is the second part of the flood in 2019, we are far better in terms of managing the crisis, both from the side of people who have been affected, as well as the government, as well as from the community. So where you see that there's a lot of learned experiences which help people to maintain themselves free from much difficulties that compared to the previous year. But 2019 was not that bad anyway compared to 2018. But still there was a lot of issues with regard to that. Now the third thing, again, you know that when we come to the third year, 2020, you find that we have both COVID and flood. And we saw on the same day the flight accident. So you see how people started helping. So basically the community, so we were afraid what will happen if a flood comes this year, because everyone is restricted to move, everyone is afraid of going and helping someone. And there was a lot of concern with regard to how volunteerism, and because government cannot do all the things by themselves. But we saw that there is a change in the social thinking. So when there was a flight accident occurred, a flight crash occurred in the airport, you found the people in the locality ran to the place to save lives. I have heard at least a number of cases where even COVID cases have been carried from local community to the hospitals. People have been affected, had difficulties, then they were taken to hospitals without worrying much about it. So there is a lot of community cohesiveness or community willingness to support each other has been mobilized to this type of issues. That's the last point, which with regard that is that there is a universality component in these all issues, because these issues are not of one person or other. Now you know that flood was not a one person's affair. We did psychosocial support to people who are affected by flood in 2018 and 19. We found that people see that as they were able to cope up with the situation basically because they found this is not their only issue of their only problem, or it is often issue of many people and people around us affected. And they look into people who have been more affected and started empathizing with them about the situation. That has helped. Now, when we come to COVID again, we are not sure whether we will get it or not, because we are not insulated from, or we are not in cocoons to save ourselves from all these type of issues. So definitely people started thinking a little more open, and people openness to help others, openness to seek support has improved. Now that's one of the indications, as Dr. Sanju said, we had along with Dr. Sanju, we had this helpline initiative called Rajagiri Wellbeing Initiative. We got within 3 days, we got around 1,300 responses to that call center through online. We had an online screening mechanism where after screening they could call us. We had a lot of calls. So there is, when anonymity is kept, yes, definitely there is willingness to seek support. Okay. So I think these stuff helped us to learn in terms of socio-cultural context. We have been learning these things.
So I could probably summarize it as saying that the urge for social connect is going to be even more going forward.
Yes,
is the takeaway that I yes. gather. I have another question. This is for Dr. Sanju. Question is from one Mr. Reddy. He says, how do physiological disabilities, can they be cured by a psychiatrist? Physiological disabilities, can they be cured by a psychiatrist?
That depends. When you say physiological disabilities, what exactly does the person mean by that? Any idea?
I'm not too sure.
Or shall I just say, what can a psychiatrist do?
Yeah, I think you should give your take on that.
Yeah. No, I think psychiatrists and psychologists deal with mental health issues. Psychologists predominantly offer talking therapies or psychotherapies, or a more sophisticated form of counseling. Even social workers, people who work in the field of mental health, psychiatrists, social workers, and psychologists have two broad sets of treatment interventions we can offer. One is talking therapies and one is medication. Psychiatrists, in instances where the severity of the condition is such, for example, severe depression, severe anxiety that's preventing someone from going to work, prevents them from leaving the house and so on, then medications might be required for a short period of time. So I think in response to the question, what can we cure? I think the general point to take home is about 75% of patients walking into a psychiatrist's clinic do not need medication. 3/4 of people can be cured by simple talking therapies. A tiny proportion, a quarter or 20 to 25% of people who have severe psychological conditions or psychiatric conditions will need medications. And even of that, only about 5 to 10% will require medications for years and years. So the stereotypes we often see on television or read in books and watch in movies, they are more the exception than the norm. The severe side effects that are portrayed of psychiatric medications, or the severe mental illness. The severe mental illness is where you hear voices and you're suspicious, you go around, stabbing people or you kill yourself. Just to place that in context, a condition like schizophrenia, the prevalence is about 1%, 1 in 100 of us. Whereas depression is as common as 25%. 1 in 4 of us in our lifetime will have a syndromal clinical depression. So it's that common, and 99% of us walk around with no residual deficits of depression. We function at our best, even if we have had an episode of depression. So if you can call that curing, I think compared to many physical conditions, nobody can cure hypertension, which is very common. No doctor can cure diabetes. No doctor can cure thyroid problems. No doctor can cure cholesterol problems. So compared to the commonest physical conditions that most of us will have once we cross the age of 50, I think most of the mental health issues can be cured, not just by psychiatrists, but psychiatrists and psychologists and social workers working as a team. The point, as you would have guessed by now, I'm indirectly and not so subtly trying to drive home is any psychological issues, seek help. That doesn't mean we'll put you on medication. That doesn't mean it will incapacitate you. That doesn't mean you're stigmatized and isolated. That doesn't mean you lose your job or your partner or your children. So for you to work at your optimum best, seek help, reprioritize. Our own psychological well-being should be, I think, in the context of what we have all gone through, we would have realized what is most important in our lives. It's not necessarily our jobs. It's not necessarily money, not necessarily other material aspects. They can all come and go in a flash. But as Dr. Anish said, that resilience, that innate ability to fight off these things and to rebuild ourselves and our communities and to share things and to do good. So be good and do good would be one motto, and be well and do good things from a psychiatric point of view. Okay, thank you. I think we've got a few questions coming. We don't have much time. So here's one question for Dr. Anish. It's from one Mr. Jose Philip. You addressed issues of middle class, but many are facing catastrophes like daily wage labor, migrant labor. Many people lost jobs, they lost their small businesses. What's going to happen to them? How are they going to impact society?
Yeah. I think this is a very important question been asked. And in my stories, I try to portray those 4 stories which I told. I told about people who have been issues of the people who are in the lower or middle income groups. And we know that people are dependent on their daily wage or dependent on their salary for that matter. So I think that is, those are the people who have been highly affected because of this COVID-19 impact. And so there have been a lot of studies about the impact of loss of income, which I try to portray, and within the 12 minutes time, I could not cover those dimensions. But definitely that's one area we need to address to a large extent. But one good thing is that the initiatives of the government, so it's not political, but looking at it from a perspective of a government's perspective, our governments have done their best, the best possible to take care of people who have been affected, but not complete, which no government can do, but not complete. Now we have to look at, that's what I talked about, migrant laborers who lost their job, whenever they went home, they used to carry a big amount of money back home. Whenever they flew back to the home, they usually flew back to the home. But now we saw large number of people who have been walking through the roads to reach their homes, or taking a immediate train they got and going back home. They had no money. So this is a big issue. So now re-employment and finding employment for people who have been affected, we need to have a have a good estimate of that. That's a wonderful question. So we need to really do a good lot of collection of data with regard to the loss of employment, loss of wages, and debt. Another thing is that I look into major places where people are, now we borrow money and we have to pay back. Now we pay on a monthly basis and you lose their income. How do you do that? Even for someone who is from a lower economic condition, they find the debt will accumulate. So that accumulation can cause trouble. This I observed even from the 2018 floods, where people have lost their home, all properties at home, and they have borrowed many things for the home based by buying on a loan, and they cannot repay it back, and they lost that thing also. Now what will happen? The bank will definitely come to them. So this is a big issue. We need to definitely have a database of these type of issues and look at how we can deploy these particular people who have lost jobs and employment to better position. So government was trying to give us temporary support for their basic needs, which is not sufficient. We have to have a long-term plan, rebuild plan. I don't know, rebuild Kerala or dream Kerala, whatever is the plan. There are plans which may come up, which are known as beautiful programs. We hope to have such things for the people around us.
So I think, to sum up, this is one area that we're yet to understand better, right? Because,
yes.
We haven't really faced a recession for a long time. This, pandemic is going to accelerate, the recession or economic distress as seen in the latest, GDP report. So I think that's something that probably we'll discuss, in the months to come. One last question to Dr. Sanju. What sort of problems, and this is from Mr. C. Ranjan Menon, what sort of problems and stresses are teachers facing during this pandemic times? Have you noticed increased anxiety and PTSD as you were talking in the teaching fraternity?
Yeah. I think I can speak both as a psychiatrist and I'm a part-time teacher. I teach at Rajagiri College myself. So I wouldn't say PTSD, because this pandemic and the changes that's brought upon us, both online teaching, which I personally find, definitely much more stressful than face-to-face teaching, whereas there are some teachers who have taken to it much better. So not PTSD, but there is definitely an element of anxiety. Not a degree of anxiety that requires treatment, but mere psychological support has been sufficient in most cases. But I think that here also we need to remember that any one time about 20% of a society, even before the pandemic, suffers from mental health issues of some sort or other. So this pandemic, so where teachers already had mild anxiety or mild depression prior to the pandemic, have had a worsening in their symptoms of anxiety post-pandemic. So they are the ones who have suddenly decompensated and who have found it more stressful. And especially in my in clinical experience, there have been more school teachers who have found it much more difficult than college teachers. And my reading is that's partly because of the over-intrusiveness of parents who often sit along with their children in classes and then keep calling school teachers saying, oh, this class, this point you made wasn't very good, or this wasn't explained sufficiently, my child is crying, and so on and so forth. Which normally I let my, I wouldn't have known what classes are being taught to my children if it wasn't for online learning. So here I can see the teachers live in action. So that gives me naturally an opportunity of wanting to get involved, and then unnecessarily and probably not deliberately, but wanting to for the betterment of the teaching, I try to get involved. So school teachers, I think, have taken the hit more than college teachers, but on the whole, high levels of depression and anxiety. And again, substance use among all kinds of professionals. Even during the time when it was unavailable, during the severe lockdown period, substance use, in terms of both smoking cigarettes and drinking alcohol, we saw which is what one of my case vignettes referred to, saw a severe increase in use of these substances by people across the socio-economic strata of Kerala. So just to summarize, those are the main issues: depression, anxiety, and use of illicit and legal substances.
Okay, thanks, Dr. Sanju. I think we've come to our close of the webinar, and I think to sum this all up, I think there are more questions than answers, but the important thing is at least we try and understand where the impact has happened. I think we all see that as social observers in our own rights, and I think to the audience, what I'd like to state is that change happens. It's just a matter of time, right? Whether it happens over a medium term or a long term or a short term, one can't really define, but change will happen. One example that I can state is that if you look at the internet adoption in the state, it is skyrocketed, because that's the only form of entertainment, the form of communication, the form of even in terms of work. We're all dependent on the internet, and internet adoption will also throw up a lot many behavioral patterns. It could also link up to addiction and have its problems. At the same time, it's also going to simplify life in more ways than one. I mean, look at the until probably the government bans Zoom, I think Zoom is here to stay. I think the way we connect with people, you just need to do a Zoom call. I mean, you don't really need to travel. Meetings, all this business travel may come down a lot. But what is interesting to note from Kerala's standpoint is how is it going to impact tourism? So because that's one of our largest contributors to the state GDP. So on that note, I wanted to thank Dr. Anish and Dr. Sanju for their time and their expertise, and going through their perspectives. I think it's a lot of learning for us. And to the audience, I also say that we will have webinars as frequently as possible, trying to unravel the environment around us, what is shaping the next normal. On that note, thank you, and have a good week.
Thank you.